Hi, good morning, everybody. This is Dr. Rosemary from Frontier Kids Care, and welcome to Frontier TV. We help at Frontier Kids Care parents who are anxious about their child's well-being in health, learning, and parenting, in the process of which they open gifts and unlock the doors to their full potential. So today we have with us on our Meet and Conversations with the Experts series, the amazing Deborah Lewis from Mamatoto Birth and Resource Center. Welcome, Debbie.
Well, thank you so much for having me, Rosemary.
Debbie is an amazing midwife, and she's going to tell us what midwives do, and she and her team do amazing work helping parents, especially the mom and the dad, through birth, the antenatally, birth, and postnatal at their Mamatoto Resource Center. So welcome, Debbie. First of all, tell us, what does Mamatoto mean? I think it's a lovely name.
Well, can I tell you, the name gets quite a lot of attention. So Mamatoto is the Swahili word for mother and baby. And, we came up with that name because we think that really it's a dyad that should never be separated at all.
Yes.
But it's also a little bit of a play. Because it's the acronym for Mothers and Midwives Alliance of Trinidad and Tobago.
Oh, I did not know that.
Yes, so we played a little bit with it, but the most important part is the mother-baby dyad.
Yes, dyad, okay.
And of course it gets smiles sometimes because, as typical Trinis, we think of different things for the Toto. And
yes.
But we said that's fine. At least they won't forget the name.
Yeah, it's an unforgettable name. I agree.
That's right. And although we're a birth center primarily, we added resource because we also do things other than care for women during their pregnancy and they can have their babies with us and so on. The resource center, just briefly, offers support groups for women who've had a loss, just postnatal women. We started a separate group for fathers because they said they needed something for themselves.
Absolutely.
And pre-COVID, we had things like in-person childbirth classes, prenatal yoga, that type of thing. So, that does really a very separate thing. But the birth center part is what we're going to focus on today.
Yes. Oh, that's fantastic. So tell us, you're a midwife. Tell us what midwives do and, their special role in this process that we just are going to talk about.
Right. So midwives, before becoming a midwife, you can do nursing. So you can do nursing and then come into midwifery, or there is what we call direct entry midwifery, where you come straight into it, regardless of the route. At the end, you've done the midwifery training. So midwives are independent practitioners who can care for a normal, low-risk women throughout their entire pregnancy, attend the birth of their baby, and then care for them up to 6 weeks after the birth. So we are educated to take care of the woman, but if anything goes off the normal track, if there's any sort of deviation, then we must refer appropriately to the obstetrician.
Great. So as I see it then, there's this triad. Of course, you talk about the dyad with the mom and the baby, Mamatoto, but also the triad between the midwife, the obstetrician, and the pediatrician, because we're here for the baby, and you working and hopefully with the obstetricians care for the mother, that mother-child fetus dyad coming to be a baby, which we then take over, right?
Exactly. So ideally, really, the team is multidisciplinary. So as you said, the midwife, the obstetrician, and the pediatrician. Yes.
Yeah. That's why we're having these conversations, because it's so important, because we are all linked together and our purpose at the end of the day is the same.
Exactly.
So we also hear a lot about doulas. Tell me, what is a doula? And do you have what's yours, what happens at Mamatoto during that birthing process? You can tell us a bit about that as well.
Okay, so a doula is traditionally a female, but she is someone who offers psychological, emotional, and physical support to the woman and her family during the labor and birthing process. There are also doulas who do postnatal support, so they have additional training so that they can provide postnatal support, but their primary role, and certainly the role that they fit into at Mamatoto, is during birth. So that, we say, sometimes people say, but doesn't a midwife also do that? And I say, yes, we can give you support, but at some point our focus has to shift to more medical things, right? When the birth is imminent, etc., we can no longer rub your back or hold your hand. And so that's really the role of the doula. So they're very focused, and that is what they do throughout the entire session.
Wow. Now, tell me, I know that a lot of times we ask mothers, what is the particular thing you're looking for in a birthing experience? And how then does Mamatoto address some of those points? Maybe you can give us to about 3 points, if you can, maybe more, about what mothers are looking for and how you provide that service at Mamatoto.
I think antenatally, the primary thing that is unique about us is that our visits are scheduled for 1 hour, for a full hour.
Yes.
And I think that is one of the main things that women are looking for, and their when I say women, of course, I mean, and their families, because the family, we're very family inclusive.
Very good.
COVID, yes, we've had to, put some sort of limit, but we really include the family. Anyway, but the visits are an hour, and I always say that to actually palpate the abdomen, feel the baby, listen to the baby's heartbeat, do the blood pressure, that really we could do in about 15 minutes. So then what in the world do we do with the other 45 minutes? I tell them we talk a lot. We like to talk. But it's just that, we see the woman and her family as really a very big picture, a more holistic picture. So we cannot just focus on the pregnancy. There's so many things that impacted and influence the actual pregnancy and the outcome. So we spend a lot of time talking. It's quite often also the only period that these families access care. Right? So we take the opportunity to do a lot of education. One of our core philosophies is that you educate. So educate in the sense of giving information, and so we spend a lot of time doing that. We will talk about all sorts of things that maybe don't even seem relevant, but they're very important for that family.
Yes.
Yes. And so that's one of the primary things I think that women want. They want to be listened to, and they want to be heard, and they want to be able to have a conversation and to talk about things that matter to them. So antenatally, absolutely the most important thing. The other thing they want is choice. Yes, they want options, but they want choice.
So good. Time and choice. Yes.
Yes. And the choice is that they want to know that they can say to you, my preference is this. My preference is to give birth in a more upright position because it just makes sense with gravity and so on. And they want to be able to talk about that. And then they want to actually have the option when they're in labor and giving birth, to be mobile and to be, in a position of their choice. And again, a part of that is to be listened to. So when they do a birth plan, they don't want sort of to be told, okay, yes, we'll see. Yeah, sure, we could. They really want you to go through that birth plan and say, I can provide this, we can try for this, I'm not sure. They want an honest, open, discussion, and to feel as if they're being heard about what they want.
Yes.
Yes. So I think those are the important things antenatally, really. Yes. And then during the birth, Just as I said, the position of their choice, to be able, most women, if they had the option when they're in labor, they want to be able to move, they want to be able to rock or to walk around. We offer a ball, you know, one of the big balls that many people use them for exercise. For us, they're birthing balls, but they use for exercise.
Yes.
But women can sit on them and bounce around and roll around. It's just the movement, the mobility that makes a huge difference. They also want to have their families with them, and that is their families as they identify them. So it's whoever it is, it's who, and we talk about all of that during the pregnancy. Who would you really absolutely love to have with you? The whole neighborhood? All right, well, let's talk about that, you know, because there are some people that want a room full. And pre-COVID, that you know, we may have, you know, discussed that, and that may have been the result, is that the room was full, giving us enough room to be able to do what we need to do. But for most people, it's their partners. And if they have other children, depending on their ages, a lot of people want their children there.
Wow, yes.
Perhaps not in the room itself when they give birth, but in the building. So we have a family room where, you know, families can wait. Yes, so the families wait there, and then they can come in right after the baby's been born. So there's that bonding, that family bonding, because that bond is so important. And for the children, for the siblings, I mean, you would know about the sibling rivalry.
Oh, yes.
So that's an important part to really make them feel included, and not just that you show up at home with this new baby.
Yes.
You know, taking their space. And then the other things that are really important, that because our families, our meaning Trinidad and Tobago, they're doing a lot of research, and they're aware of what the scientific evidence is saying, you know, and so the other things such as delayed cord clamping and immediate skin-to-skin contact.
Yes, so important with the breastfeeding initiation.
Exactly, and the breastfeeding initiation within the first hour after birth, and those things are really important to them as well.
Yes.
That really is a very routine part of what we provide.
Yes.
You know, it's sort of the standard. So again, those types of things are what people come to us looking for. We also offer water births, so births in water. Yes, and so some people come specifically looking for that, and you know, that's also another discussion, because they think, well, how does that work? You know, but I tell them the baby's living in a bag of water for 9 months. So it's water to water, it's sort of a more gentle transition. And it's not as if we keep them under the water for very long. You know, their heads do come out immediately.
Wow.
So
when the moms do that, are they more relaxed? Because what I hear, what I'm hearing, the underlying thing in the whole conversation, it seems to me, is that it's natural. It's making birth much more natural, rather than, you know, the way we've sort of made it a separate event. It's more incorporated into the natural rhythm of family life, as it were. So do you find that, you know, the moms relax a lot more when they have the water births?
They do, and the examples that I give them is, you know, if you're in the ocean, if you're at the beach or something, you know, you can float, because the water is just so supportive and relaxing. And that's the same principle for the water birth. They just absolutely relax when they get into the water. And women who have done both, so what we would say a land birth and then a water birth, have said that the difference is really amazing. As soon as they get into the water, they just totally relax.
Yes, I would.
And they have said that the babies who were born in the water generally are more, they're more I want to say relaxed, but they're usually a little bit more gentle. So they don't, they're not as fussy.
Yeah.
Even their transition when they're born in the water can sometimes feel as if, oh, is this baby okay? But even that transition is more gentle. They'll give you enough of a cry to say, I'm okay, don't worry about me, I'm fine. And then they're usually pretty quiet.
Yes.
After that, yeah.
Very
so
good.
definitely the water birth makes a big difference.
Good. And then what are people looking for from you postnatally?
Postnatally, I think this is really where we have a big impact. Yeah. And that's just simply in one word, maybe support.
Support, yes.
Support. We do really close follow-up. So we do daily phone calls when they go home. We see them for a 1-week visit. The phone calls then continue weekly until their 6-week visit. And then we go into a sort of irregular follow-up, so periodic follow-up. But we do follow-up up to a year-old because we do breastfeeding statistics up to a year. So we do follow-up calls up to a year. But I think that support and knowing that you have someone that you can contact instead of bothering the pediatricians too quickly.
We don't mind.
But for minor things and really just to ensure that everything is going the way that it should be. And even if they have no questions and no concerns, I think just the touch base, really feels good. And it does not matter. We have a mom recently who it was her 3rd baby. But, I tell them all the time, each baby does things differently and they do things that the others never did. And so they make you have questions about, I wonder, and so she really said that she so appreciated the follow-up. Yes. The contact, that even if she didn't reach out with any questions, we were reaching out to her, just saying hello, just checking in, that everything's okay. And I think that's really what they appreciate most.
Yeah. Very good. That's excellent, because from our end, what's the pediatric side of things, I guess we would intervene antenatally and then postnatally. I mean, sometimes the pediatrician is at birth, but in the birth setting at your center, well, obviously midwives are there and handle everything. So antenatally, I think a lot of parents have anxiety about the birth. And when I'm listening to what people say, they tell me that they wish they knew they could have spoken to someone before birth, so that when they go into birth, they're more prepared. So we've listened, and now we offer complimentary antenatal consultations to parents who are going into birth and have questions. They want to know, what type of birth am I going to be, and we try to let them know that they're a good mother from even before they go in, because that's a huge thing, doubt of their mothering, what their mothering skills will be like, because people bring their whole family history with them into the birthing room. And if you have a chance to talk to them before, you can allay some of those fears. Talk to them from before about breastfeeding, if that's what they want to do, and how to do it, and when to seek help, and those sort of things. So antenatally, we as pediatricians can really help with a lot of the anxiety that naturally comes with being a parent. Even if you've done it many times, it's there. You may get better with time, but different times produce different anxieties. For example, in this time of COVID, I find parents are really super anxious because there's so many things apart from, this new baby or the new impending birth that they're worried about,
Yeah. Yes.
So antenatally, we can help them through telehealth or even a face-to-face visit. But telehealth is easy, social distancing, and you can talk to, a pediatrician, meet someone, and then, get the help that you need. And then afterwards now, after delivery, after, you call and say, I'm sending a baby.
Yes.
Which you all do so well. So like a 2 days or or thereabouts, we see the new family, and the mom, dad, and kids sometimes come along, sometimes not, whoever, grandparent, usually oftentimes in our setting, a grandparent may come along, you know, grandmother. And, you know, you then have the opportunity to, you know, bring this baby as a new gift and tell the parents that you're doing a great job, because the huge issues are the mild or sometimes more severe postnatal depression that you may pick up, you know, many times it's not severe, just mild, but letting them know that it's okay. And then helping them with the breastfeeding is another huge, you know, anxiety that moms have. And also telling them really right then that they're a great parent, and that you wouldn't believe. You can do everything else, but you just tell them that they're fantastic and they're doing a great job and we're here for you. They leave with a certain burden off their back, because that was a huge thing, you know, and they're not sleeping well at night. We talk to them about self-care, how to look after yourself, get people to come and help you intentionally. So you get, you know, Trinidad relatives come, everybody's come, well, not now in COVID time, but people come and they come around and they're really taking away from you. So what you have to say is, listen, I need help with food, I need drinks, I need this, I need some chores done, help me sweep, help me do this. And then you now can just relax with the baby and breastfeed if that's what you're doing, and so on. So this is a kind of advice that they need to get at that time.
Yes.
Then a little later on, or sometimes at that time too, you have cord issues, well, you know, right after birth, and also, you know, eczema, you know, things that really make parents really, really worry more than you think.
Yes.
So sometimes I might think this is just a little mild rash, a little newborn rash, and you know, but to that mom, this is like the worst thing in the world.
Yes.
Isn't that true? And
yes.
So sometimes what you do is, you know, I've gotten better with time and listening to what the mom really is worried about and trying to help with that. Because I mean, you can treat a rash easily, but it's not so easy to treat the, you know, the underlying anxiety that may be there with whatever the baby may present with. Then of course you have issues like babies with special diagnoses and so on, and that's another particular thing that you have to help parents through in a big way, you know. So that's how we at the other end of the triad, you know, do our part to continue that gift. Birthing is a gift. You know, when the child comes to you, that's another gift. That my job now is to take it over and see how you can help this child become the best version of themselves, you know, through their parents. So,
and I really just want to reaffirm what you're saying, because yes, those are the exact same, those are definitely the things that concern them. And the thing that you said that is so important is to listen to how it's impacting them.
Yes.
Because, you know, for one mom, I said, no, that's just, you know, a newborn rash. And have you seen your pediatrician yet? And she said, just a newborn rash, but this looks so awful. She said, I can't stand to watch my baby with this red rash all over her body, you know, so it's their perception of what is happening. That's so important. And I just want to reinforce as well that it's really important. We really encourage them to start the relationship with the pediatrician, because too many times our families wait until there's really a big concern, or they put it off and they put it off. So we stress it's really important to start your relationship with your pediatrician antenatally, but even if not antenatally, then right after the baby's born. Don't wait until they have to start their shots, or don't wait until something, you know, it's really important to get that support and the help. So yes, anybody who's looking, make sure you schedule that. But even for us, you know, I said we do such close postnatal support, but a pediatrician, that's a very different sort of support. That we feel really, as we said, it really enhances, you know, working together with our support and what now this baby needs from the pediatrician and the family needs. Working together is what is really the ideal.
So last thing, And
Mhm.
I guess this is what we're dealing with now, this COVID-19 pandemic that has impacted on our lives, and obviously the birthing process, antenatal and postnatal. What
Mhm.
particular things are you doing at Mamatoto Center to make the birth safe? Because people have, obviously issues about that and social
Right.
distancing and everything.
Right. Well, we've put, sort of the basic things in place, like all of the staff wears a mask. We ask anyone who is with the woman to wear a mask. We do not require the woman herself to have a mask on during the labor and birth, because, we say take deep breaths and give the baby oxygen, but if a mask is in place, and very, very careful sanitization.
Yeah.
Antenatally, we've now put a gap between our visits that gives us time to sanitize the office, the examination room, and everywhere. And we do limit the number of persons that can attend with her. We have had to put a limit in place for the visits and also for the birth.
Yes.
So for the birth as well, masks, sanitizing constantly. We have wall sanitizers, hand sanitizer, the little bottles everywhere,
Yes.
and limit the number of people. I think some of the things, were already in place.
Yes.
So I think we've just sort of amped it up a little bit.
Yes.
So that it's done more regularly and so on.
Yes.
So I think screening, we do not currently require any testing. Specific testing, but we do very careful screening. So there's a questionnaire. It feels like you're taking an exam, but there is a questionnaire before you come into the center and on arrival at the center that every person entering has to complete.
Right.
So it's questions like, have you been exposed? Have you had these symptoms? The sort of questions that would help us determine anyone who's at risk.
Yes, well, that is good. And the last question really is the use of telehealth or I'm imagining, I know for our practice, because the COVID sort of pivot, we had to pivot into telehealth. We've been talking about it for a long time, and then all of a sudden it became a reality. And, it really helps in the present situation to be able to do telehealth visits for reviews, as I told you, antenatally, and even to assess risk for patients coming in. We can talk to them before and find out what's really the issue. I am thinking about that, in your birthing room, it would be so lovely to have, I don't know if you do it yet, that the extended family who wanted to witness, be there. Can they witness the birth, while someone has a camera? And also, are you doing any sort of telehealth or online consultations?
So when they say, well, they'd like to have, all these extended persons, I tell them we have excellent internet service. Yes, they sign in and they can set up, their laptops, or some of them will wait until after and do perhaps a WhatsApp video call or FaceTime call or something. So yes, we utilize that and always did.
Yes.
But now even more, as I said, because those are some of those people may have been present in that family room, but we can't, at this point. And so yes, they can join on video. So we definitely do that a lot. In terms of the telehealth and consultations and so on, we do it. But during pregnancy, at some point you have to do, in person.
Yes.
So what we will do, is more sort of a screening. So we'll do a telephone screening to determine, do they need to come in now? Can we, delay the visit? Are there things that they can do in the interim? And then we do the visit perhaps a week or two later, so that we do limit the number of visits and so therefore the exposure. So we haven't been able to really use it a lot, but we do use it. We absolutely use it more than we did before to determine, how necessary is the in-person visit.
Good. Well, it's like a blended sort of system.
Yes.
Because
yeah.
now both of our situations, touch is important. You cannot not
Yeah.
touch or
Yes.
have a face-to-face visit. I mean, you just can't.
Yes.
Can't deliver a baby virtually yet. So, thank you, Debbie. This was really a very lovely conversation, full of lots of nuggets, and also telling us how important your what you do and what Mamatoto does, and institutions such as that, birthing centers, in the whole scenario of bringing a new baby into the world for families. So I'd like to thank you for this conversation. Tell us, how can we find you?
So Mamatoto we're on Facebook, we're on Instagram, very easy. There are not a lot of places with that name. You can't mix us up, really. We do have a website that you can go to for further information. And of course, you can also call us if you'd like to. All of the contact information would be on any of those platforms.
Yes.
So you can reach out and give us a call if you want to hear a voice. But much of the information is available online.
Yeah, and deliver a baby.
Yes.
So, thank you. For those of us listening to Frontier TV here, you know how to find us. If there are new moms out there who want to schedule our complimentary antenatal consultation, feel free to make the appointment online on the website, frontierkidscare.com. And we will put all the links below in the YouTube video. So it was really nice. Thank you very much, and take care. Bye for now. For those moms who are about to deliver, have a safe delivery, hopefully at Mamatoto Birthing Center. If you are, your risk fits there. And afterwards, we may see you at Frontier Kids Care to continue the journey up until age 18 years, birth to 18. So Debbie, thank you and take care, and bye for now. Be safe, everyone.
Thanks very much. Bye-bye.
Okay, bye.
Bye.